Anytime that we have a disease that is extremely rare, there's often a long challenge to get a diagnosis made, because sometimes family physicians, general practitioners have never seen this before and don't necessarily recognize the symptoms and put it in with a particular disease. So somebody who has, for example, type B Nieman-Pick, there's a big spectrum of how they can present. They can have lung disease. I've had patients told that they have pneumonia over and over again when in fact it's Nieman-Pick. They can have symptoms relating to their liver and spleen, and I've had patients who've been diagnosed or thought that they might have things like cancer. So sometimes it takes months, sometimes it takes up to years before a diagnosis is eventually made. And it often takes somebody to be referred to a specialist to put everything together and make the diagnosis eventually. For things that are more severe, like infantile Krabbe disease or type A Nieman-Pick, sometimes it's a little easier to make the diagnosis because the presentation is so dramatic and it's so early on that it often makes people assume that it's not something common like pneumonia, that it is a genetic disease. 22q is very challenging to diagnose often because the symptoms can be so wide. They can be psychiatric disease, they can be a cleft palate, they can have immunologic problems, and it's challenging to diagnose them because not every child who has 22q looks like every other child. So again, even then, there can be delays in presentation. For Krabbe disease, because the infantile form is so severe, we are now doing newborn screening for it in several states. So any baby who's born in, I think, 7 different states now is screened at birth for Krabbe disease so that they can be diagnosed early and treatment options can be presented to the parents.